You know, the NHS, supposedly the envy of the world. But the reality is that healthcare in the United Kingdom is in absolute crisis. And if we just look at a few examples, despite record funding in the NHS, we've got record waiting lists, well over 7.5 million. And that's just on the official list. We've got a staffing crisis. We've got an ambulance crisis, an A&E crisis. We've got excess deaths crisis for reasons that, frankly, most people either don't know or they don't want to talk about. And that's why we've committed to having an excess deaths inquiry. And sadly, unbelievably, we've actually got some of the worst outcomes on areas like cancer care, heart disease in the developed world. And that is an absolute outrage. No one's listening to what the Tories say anymore. Frankly, we just want a general election, and that's what we're focused on. We're focused on the general elections. Yes, there are the locals, but the truth is the country wants a general election. But there's no answers from the Labour Party, really, on healthcare. Once again, they're betraying decent working people. Whereas Reform, we have a bold, ambitious plan. We're the only party that says, right, we're going to get to zero waiting lists in 2 years. Some of you might say that's impossible. I say stop being so weak and pathetic. Yes, it's challenging, but we need a national goal that the country goes for. The staffing crisis. The NHS is losing people all the time, struggling to attract people. Well, the way to retain and attract people is to say, actually, right, anybody on the front line of patient care, in healthcare or social care, then you'll have zero basic rate income tax for 3 years. That is a significant increase in the net pay. We first touched on this just over a year ago. We would have sorted out all of these strikes, but the government ignored us. That'll retain and attract talent. The other thing that we need is we've got to bring in serious logistics experts from the likes of the Amazons, the FedExes of this world, from the military, to sort out the issues, the lack of productivity, the blocking all the way through hospitals, in order to get many more operations done 7 days a week, not 4.5 days a week. The second key thing after dealing with the staffing crisis is that actually we've got to use the significant available independent healthcare capacity. The NHS needs to acquire millions of operations and appointments from the independent sector. And guess what? Where there's money involved, capacity will rapidly grow. And that's what will happen. What we're talking about here, to get to zero waiting lists in just 2 years, is about a 20% increase in the number of appointments and the number of operations. Many businesses achieve that every year. And I'm saying to all of us, I'm saying we can do that within healthcare. But actually we need a grown-up discussion about how we operate healthcare in this country in the future. Do you remember in previous general elections, you get that pathetic whining from the Labour Party, oh, 24 hours to save the NHS. For God's sake, grow up, right? What we actually need to say is, if you can afford to pay a bit more, then we'd like to encourage you morally to pay a bit more. And the way to do that is to actually incentivise people through the tax system. So if you can afford to pay a bit more, we'll give you tax relief on private health insurance, on self-pay, because what that will do is significantly ease the pressure, reduce the demands on the NHS, so that actually all of us will get better, faster care for the future. This is the way to transform the way that healthcare is delivered in the United Kingdom. And it's only Reform UK that once again has the courage to take on this debate that previously none of the main parties dare talk about. Well, we're going to talk about it because we're the only party that has a clear plan to sort this mess out.